For months now, we have all been waiting anxiously for even the slightest amount of relief from the novel coronavirus pandemic and the toll it is taking on our frontline workers, hospitals, and everyone's well-being. Thankfully, help is finally here for Riverside County, and residents can get a sense of hope. Although this will not be an overnight fix, the recently approved Pfizer vaccine is said to be about 95% effective against the coronavirus. Today, Friday, December 18th, close to 15,000 doses of the Pfizer vaccine are arriving at Riverside University Health System, public health facilities, and several pre-selected hospitals, which include Loma Linda Murrieta, Rancho Springs, Inland Valley, and Temecula Valley Hospital. Now, this amount of doses will be enough to vaccinate about 7,000 people. Limited supplies of the COVID-19 vaccination will be distributed in 2 subphases in the attempt to reach critical populations first. Phase 1A will start with healthcare personnel who are treating patients with COVID-19. Phase 1A includes 3 tiers that will be administered to certain healthcare workers in order of importance. The first tier are those on the front lines directly involved with patient care, while the second and third tiers are care providers at risk of indirect COVID exposure. Phase 1B will include essential workers and those who are at high risk for severe illness or death, including those who are 65 years of age and older. Phase 2 will aim to vaccinate the remainder of Phase 1, critical populations, and the general public. By Phase 3, the Riverside University Health System is hopeful that there will be a sufficient supply of the vaccine for the entire population. This news is extremely timely, as Riverside County just announced that they are at a 0.0% ICU bed capacity, which includes both COVID and non-COVID patients. On December 14th, Governor Newsom tweeted that another 393,000 more Pfizer vaccines are expected to arrive next week. Moderna, the second COVID-19 vaccine, appears to be on track for approval by regulators. It is anticipated to be distributed as early as next week. Now, you may be wondering, when is it your turn in line to receive the vaccine? Conveniently, abc7.com has a questionnaire based on a nationally used vaccine allocation planner tool, making it very easy to see what category you fall in and when to expect your vaccination. You select the state and county you live in, your industry of work, your age, address any medical conditions, and your residential situation, and you can see what phase you fall under. Based off of my answers, I won't be vaccinated until Phase 3. It is important to know that in this challenging time, there are COVID-19 vaccine scams happening. Please note that you cannot pay to put your name on a list for higher priority, nor will you get a call about the vaccine in exchange for personal information. Be sure to continue all COVID-19 safety protocols. Vaccinating healthcare workers will provide some defense, but won't provide relief initially in the current surge of cases.